Welcome, everybody, and thank you for joining us. In the next hour or so, Professor Hung and I are going to try to answer as many questions as we can about the effectiveness and safety of these vaccines, and then some other miscellaneous questions. Now, because Professor Hung will have to leave a little bit early, we will go directly first to the vaccine safety related issues. And I just want to point out that the audience has sent in over 50 questions, so we will try to get to as many of them as possible. Ivan?
Thanks, KG. It's my real privilege to be here, and we will just go through some safety concerning the COVID-19 vaccine issues, and then I will pass it to Professor KG Fukuda concerning on question concerning the effectiveness of the vaccine. So with regards to the safety of the vaccine, I think a lot of people are concerned about the choices of the vaccine. Currently in Hong Kong, we have the choice of an inactivated vaccine with the Sinovac or an mRNA vaccine with the Pfizer-BioNTech. Overall, I think it's important to understand the mechanism of the vaccine. With the just briefly talking about the BioNTech vaccine is an mRNA vaccine. Is actually the technology has been there for more than 10 years. Nevertheless, had not been used because of the expenses or the financial support to develop such vaccine. And now, because we have a pandemic, it's just the right time to use the mRNA vaccine. And of course, we know from the vaccine itself is first of all. The vaccine is using the mRNA segment of the spike protein, and of course that is caused a very robust immunogenic response in terms of neutralizing antibody as well as in the cell-mediated immunity. Important to note, of course, is that the RNA segment has never ever entered the host nucleus, and hence it will not change the host DNA. And therefore, you should not be worrying about whether there is any mutant generation or whether it will affect the genetic makeup of the host, or it will cause some very long-term side effects. The RNA that is very transiently present in the cytoplasm of the nucleus of the host cell, and it will be expressed on the host cell after reconstitution from the spike protein. And then it will, of course, be through the antigen presenting cell, be stimulating both the T and the B cells. On the other hand, for the inactivated vaccine, the Sinovac or the Sinopharm is basically based on the very conventional technology of vaccinology, and hence is again very safe. It will basically using an inactivated a biochemically inactivated whole cell virus to stimulate, of course, the antigen presenting cell to take up the spike protein, and then, of course, causing a stimulation of the neutralizing antibody formation by the T and the B cell. The downside, of course, it does not stimulate the cell-mediated immunity, and hence, in terms of the robust or the it will not be as immunogenic as the mRNA vaccine or the AstraZeneca adenovirus vector-based vaccine. Another vaccines that are currently in development, of course, and also just to comment on the inactivated vaccine, is that because it actually current vaccine is using the original virus from Wuhan of the first generation. So in terms of the variance protection, it will not be as good as the other platform until it changes the antigen and using the Delta variant as the antigen for the stimulation. In terms of the Novavax recombinant protein vaccine, again, it uses a novel technology. And then, of course, it was first in vitro using the Bello virus to stimulate in a moth cell culture to harvest the the spike protein, and then subsequently reconjugated to form the Novavax recombinant protein vaccine. It is known to be very safe, and of course, it can also stimulate the cell-mediated immunity. The adenovirus vector, on the other hand, is using the adenovirus to carry the viral DNA, and then again subsequently able to stimulate by expressing the spike protein, and also that the other fragment of the virus to stimulate the T and the B cell. And again, also it had a direct stimulation of the cell-mediated immunity as well. So really, the choices of the vaccine depends on whether that type of vaccine is available in your country or that particular city. And then, of course, it depends on the individual of your choice. All the vaccine platforms are currently very safe, apart from, of course, some minor side effects. For example, with the adenovirus vector-based vaccine, the concern is of the very rare thromboembolism that occurs in female below the age of 60 due to the antiplatelet antibody formation. And already that vaccine is not recommended for female below the age of 60. Otherwise, the vaccine is very safe in other age cohort. So really depends on your own choice, and also that also depending on the type of subjects. For example, for immunocompromised hosts or patients who are on immunosuppressant, we will recommend a much stronger stimulating vaccine or much more immunogenic vaccine. That implies, of course, an mRNA vaccine of the Pfizer-BioNTech type in this cohort. But otherwise, for other or for elderly, perhaps the more immunogenic Pfizer-BioNTech will be a better protection compared to the inactivated vaccine platform. The other questions that are currently raised, of course, is the myocarditis question. That, of course, we know that there is a low risk of around 16 to 30 per million, depending on the study that you're based on, of young male subjects below the age of 30 are prone to getting a mild type of myocarditis. Nevertheless, studies from Israel and US have shown that these cases are rare, and that majority of these cases occurred in young male vaccinees below the age of 30, and that the symptoms tends to be of a chest pain or shortness of breath 2 to 3 days after the vaccination. So in general, it is first of all very rare, and then overall it is very mild. And of course, if that happens to that individual or to your children, then of course they should be admitted through the A&E for a cardiac consultation. Then of course we will look at the ECG, we will look at the cardiac enzyme. Overall, the recovery is very well. More than 90% will have a very prompt recovery. The others, of course, will have probably need a more longer hospitalization, but overall the recovery is very good, and the prognosis is very good. And that we advise young male patient, of course, young patient after, or in general, anyone who have been vaccinated, not to take any strenuous exercise for the first week after the vaccination, and to take note of this kind of symptom. And if that happens, you should seek medical consultation. Third question is on mixed platform and booster. Overall, mixed platform is safe from our study. And of course, if you have been vaccinated with 2 doses of one particular platform, for example, the mRNA platform, then you will, of course, be free to receive a 3rd dose of your choice when it's indicated, perhaps next year or the year after, and it will be safe to mix the vaccine platform. However, for individuals who have only received the prime dose, have yet to receive the 2nd dose, we do not advise mixing platform right now, because we have very few data on the mixed platform, vaccine platform, in terms of safety and immunological data. In terms of the mixed platform study, the trial is currently ongoing at the Ablai Vaccination Center under HKU, and hopefully we'll have some preliminary data in late July, early August. Overall, the 50 vaccinees have undergone the mixed platform and are currently, we do not see any adverse effects in our cohort. And these individuals have received a first dose of BioNTech priming, followed by a Sinovac booster. With regards to the third dose booster, already you have heard on the news that the Pfizer-BioNTech is currently applying for the FDA for the booster dose. And of course, in mainland China, we know that they are already looking and already starting trial on changing the antigen of the inactivated vaccine for a booster. However, the timing of the booster have yet to be determined. So hopefully we will be able to keep you updated after the advisory panel have had and the Joint Scientific Committee have a detailed look at the data when it's available from these various pharmaceuticals respectively. In terms of the short and long-term side effects, we can give a comment that, of course, out of the close to the 4 million doses that have been given, the safety panel, advisory panel have been keep tracking of these cases. Overall, the both vaccine platforms are very safe, and just in most subjects have some very short-term side effects, local side effects consisting a sore arm, or probably some individual may have a transient fever or minor headache for a few days. So overall, a majority of these side effects are very short-term. In terms of more severe systemic side effects or adverse events, that will concern, of course, things like Bell's palsy, or some individual may develop lymphadenopathy. With regards to the local lymphadenopathy, most subjects will have these lymphadenopathy subsided after like a week or so without any sequelae. For individual who develop palpitation against its transient events, and usually if it persists, then of course you should seek medical help to see a cardiologist, and also to look at your ECG pattern and to see whether there are underlying causes for these palpitation or for these arrhythmia. In terms of Bell's palsy, then of course we have just seen 100 cases of Bell's palsy out of the 4 million doses given, and the percentage is about half from the Sinovac platform and half from the BioNTech platform. From the study by Professor Yin Wong and myself, we understand that these Bell's palsy tends to occur within the first few days after vaccination, and that the Bell's palsy tends to be relatively so-called minor, and that if you have received medical care with the treatment of steroid, the recovery is more than 90% overall, and that from the current data, and that of course the Bell's palsy tends to be relatively mild, and of course that the reason for the Bell's palsy is likely to be related to the transient inflammation of the facial nerve that pass through a narrow passage in the skull, and hence that once it's swollen, it will cause a Bell's palsy, or it could be related to some interferon or autoimmune antibody. But overall, the recovery is very well and relatively minor. And then, of course, the Sinovac have already filed for addition of the Bell's palsy as one of the very infrequent side effects of the vaccine. In terms of elderly population and side effects, in general, vaccinating the elderly population is very safe with either platform. The recent and overall, the severe side effects are very few. Nevertheless, of course, if you compare to the younger population, the so-called side effects is maybe a little bit more of so-called related, because of the elderly have more comorbidity compared to the younger population. So with vaccination, we understand that for each vaccine, there will be some kind of minor inflammation of concern. In fact, for all kinds of vaccine, you have some transient minor inflammation. So if in the elderly population, if they have a critical disease, an undiagnosed critical disease, then of course they may have some kind of exacerbation. So it's important for the elderly population, if they have some uncontrolled illness, for example, if they have uncontrolled hypertension, if they have symptomatic, if they have ongoing chest pain or shortness of breath, for anything that are symptomatic, then they should be treated by the family physician or the specialist before receiving the vaccine. However, if the elderly population, they have already been treated for their chronic illness, which are well controlled and they are already on medication, then they could safely receive either vaccine. The other thing, of course, is that for the elderly population, if they are chronic smoker, then of course we do recommend them to seek medical help, or that they have to seek the advice from a cardiologist before receiving the vaccine, because they may have underlying coronary artery disease. However, if they have already been treated, they're on medication to treat the high hypertension, the lipid, or the diabetes, or that they have undergone a percutaneous coronary intervention, they have already have the angioplasty to treat the coronary artery disease, then or they're already on antiplatelet agent or medication for that, then they should not be worrying, and then they could receive the vaccine very safely. For individuals who have a previous history of eczema, for asthma, or food allergy, then again, they don't need any screening. They could receive the vaccine very safely. The only cohort who need to be screened at the allergy clinic are subjects who have 2 confirmed drug allergy. Most of them, of course, will be antibiotics allergy. If there are 2 classes of antibiotics they are allergic to, or if they have 2 confirmed allergy to medicine, to a certain drugs, or that they have anaphylaxis, meaning that they have some acute severe allergy response after vaccination or to a drug that they could not breathe, they have they collapse after the vaccine or the drugs, then they should undergo a skin test at the allergy clinic. And you can, of course, seek referral from your own family doctors to the allergy clinic at the government, at Grantham Hospital, or you could ask to be, you can seek consultation at the private clinic, at the Hong Kong Sanatorium, or from the private immunologist, that they also do skin testing for in particular for the polyethylene glycol that is deemed to be the allergens that is present in the BioNTech vaccine, that can also have traces of contents of some of the medications. Reason why we want to do the skin testing. Another question, of course, is concerning the chronic illnesses. Are there any concern in receiving the vaccine? And a lot of people ask about the patient if they are chronic hepatitis B carrier, either they have received the antiviral or not, are they safe to receive the vaccine? The answer is yes. They could safely receive the vaccine if they are hepatitis B carrier, or either they have been treated or not. They could safely receive the vaccine because the vaccine, first of all, have no effect on the virus itself, and they have no effect on the liver. of these vaccinees. For patients who have had underlying arrhythmia, for example, Wolff-Parkinson-White syndrome, or they have a history of epilepsy, hyperthyroidism, or they have felt or migraine, provided they are treated, they are well controlled, if they are already on anti-epileptic agent or they are on thyroid medication, the arrhythmia, they are already on medication, well controlled, then again, they can safely receive the vaccine. For individuals who have thalassemia trait, that again, there's no contraindicated for vaccine, they can go and receive the vaccine anytime. As said already, if you have chronic illnesses, for example, hypertension, diabetes, hyperlipidemia, coronary artery disease, again, if you have already been investigated, already on treatment, you can safely receive the vaccine without any extra consultation. For individuals who are post-transplant or immunocompromised host, again, they should receive the vaccine as soon as possible. And again, we will recommend using the BioNTech vaccine because it's much more immunogenic. With regards to the booster, the third dose booster after 2 doses, we are currently looking at these data with the Joint Scientific Committee, and we probably will roll out some kind of a clinical trial, or we have some so-called indication that we will informing the public or the patients once the Joint Scientific Committee have come to any conclusion. In terms of children vaccination, currently, of course, the BioNTech have already been approved, and the vaccination is started between the age of 12 to 16. And again, we strongly recommend children to get vaccinated. The only thing that you should be aware of course, is the high chance of myocarditis, especially in male adolescents. That again, strenuous exercise should be avoided for the first week. And of course, you should be looking out for symptoms of chest pain and shortness of breath, which I have already said is extremely rare for myocarditis. But if you have this kind of symptom, then you should seek medical help as soon as possible. With regards to younger age group, I think the currently Pfizer-BioNTech and also the Sinovac are currently performing a phase 3 trial, and hopefully we'll have those data in terms of safety and immunogenicity very soon. And then the advisory panel will be able to, together with the Joint Scientific Committee, will be able to give advices to the government with regards to the younger age group vaccination based on the phase 3 results and data and publication. In pregnancy and lactating mother, again, now already the FDA, the CDC, as well as the Royal College and the Hong Kong College of Obstetrics and Gynecology have already expressed that the BioNTech vaccine are very safe in pregnancy and lactating mother. So a mother who are already pregnant or currently lactating, they could safely receive the BioNTech vaccine. Similarly, for those who are post-operation and also have planned pregnancy, they could receive the vaccine anytime. As I've said, the RNA vaccine will not affect the host DNA at all, or also the fetus DNA as such. And of course, that if you have any concern, then of course you should still seek the advice from your obstetrician. In terms of the SARS versus MERS or COVID mortality, of course, they have run rough data based on our previous research. For SARS, the mortality was around somewhere around 10%. For MERS, is around 30%, and for COVID is currently running around something like 2.5%. Looking at the overall data, and higher in certain country. The importance, of course, is that you should receive the vaccine as quickly as you can. That will again protect you against COVID-19 infection. But more important, not just preventing the infection, but to prevent any severe complication and it will reduce the risk of complications, pneumonia, as well as the need for ICU care, ventilatory support, and also mortality. In terms of the treatment, of course, we know that if you are able to give the treatment earlier within the first week with, for example, remdesivir and interferon, you will have that will improve your survival. And of course, many patients do receive the treatment if they have been given early on within the first week from symptom onset. And finally, of course, the question is about those who have already received the vaccine overseas already received one dose of either BioNTech or the AstraZeneca, and they want to come back, or for those who have been, for example, studying overseas and they return to Hong Kong, could they get a second dose? The answer is yes. You can receive a second dose by special arrangement, and you should write to the CHP for this special arrangement that the second dose of the BioNTech could be arranged by special arrangement. And of course, for those who have had an infection before, the current recommendation is to receive one dose of booster of either Sinovac or the BioNTech. And again, you will receive a certificate certifying that you have completed the vaccination because you have recovered from the vaccine, and only one dose of booster will be needed. So with this, I've answered my part, and I will pass to Professor Keiji Fukuda.
Thanks, Ivan. So have another group of questions which are related to how effective are these vaccines? How good are they? And one of the questions was really very basic, and basically pointing out that even reading about these vaccines can be confusing. They're described in different ways, and so people hear that they're more effective or less effective, and it keeps changing and so on. And so the first question is related to that, and basically asking for an explanation of what numbers should people really look at. So I think the first point here, I just want to say that it is confusing. When you read the newspapers or you read different articles, you will get a lot of different numbers, and they appear to change over time. But a lot of these numbers reflect this basic idea of how effective is a vaccine, or vaccine effectiveness. And so a simple way to think about it is that in concept, if we have a group of people who have received vaccine, and then a similar group of people who have not received vaccine, then we can compare them for different outcomes. So we might look at them in terms of differences in rates of infection, or rates of symptomatic disease, what we often call cases, or in terms of rates of how often people get hospitalized for COVID, or how often people die from COVID. And so if we see that a vaccine is, for example, 95% effective, what that means is that if you look at the vaccinated group, what that means is that they will have a 95% reduction in the outcome compared to the non-vaccinated group. So perhaps 95% reduction in the number of people who develop symptomatic COVID. And to make it a little bit more confusing is that oftentimes studies will look at different outcomes in the same study. And that the reason for that is that basically there are different questions that we want to understand about the vaccines. And so epidemiologists, for example, may want to model how is the epidemic spreading, and then they need to know about infection and cases. But for the average person, and I think the person is really writing from this perspective, for the average person, what we're probably most interested in is vaccine going to help me avoid getting seriously sick, perhaps being hospitalized or dying? And so that is really the bottom line for most people. And so focusing on effectiveness in terms of how much does it reduce my chances for getting hospitalized or dying makes sense. But I do want to give you a little bit of advice. I think you can drive yourself crazy by trying to compare parameters across different vaccines. There are now a lot of vaccines out there, and depending on whether a study comes from one country or another, you are also going to see different effectiveness numbers for the same vaccine. I think the bottom line advice is that if a vaccine has been approved by a good regulatory agency, you can take it for granted that it's going to give you much, much more protection against all of those outcomes than not being vaccinated. And so that's the bottom line. Now, a second question that came in is about vaccine. How long is vaccine going to be effective for? And so right now, we don't actually know how long the maximum duration of protection is against either natural infection or immunity resulting from vaccination. So, in a recent review article, we know that natural immunity can last for at least 8 months. And we also know from a number of different studies that vaccine immunity appears to last for at least 6 months and longer, but we don't know how long the ultimate duration is going to be. And so, just to put this in context, we simply need more time to study the vaccines and the disease and see how long immunity lasts. And so that's one thing. The second thing is that the immune protection against this infection is actually a bit complicated. And so we don't fully understand all of the basis of the immune protection. And so this is being worked out right now. But the third factor that I just want to raise so you have an understanding is that the viruses themselves continue to mutate. So the virus causing COVID mutates over time. Many of those mutations don't really make much of a difference in terms of, changing the virus in important ways. But some of them do change the virus in important ways. And so we have a number of variants of concern. And so sometimes as the virus mutates, it can mean that the vaccines that we have now become less effective. So bottom line, the vaccines appear to be effective for a pretty long period of time. And it may be, we will see that they can be effective for, a year or so. But right now we have to document that. Now, a third question which came is that a person said that we're fully vaccinated 3 months ago with the BioNTech vaccine, which is, Ivan mentioned, is one of the mRNA vaccines, and is asking about boosters. And so, Professor Hung already discussed boosters to some length. And just to put some of those comments again into context, right now, if you read the newspapers or read the internet, you will see that there are different agencies giving different recommendations on boosters. So for example, in the last week or so, CDC in the United States basically said they don't believe that boosters are needed right now, but they left the door open that as more information becomes available, that boosters may be recommended. On the other hand, you'll see that some countries like Israel have gone ahead and are recommending that boosters be available. And so there's a kind of difference right now because the data are not fully clear. And then as Ivan mentioned, there are some companies that have gone ahead and are seeking authorization for their vaccines to be used as a booster. And so I think that there are some companies that are going ahead to look for authorization. But if I was to sum all of this up right now, I would say that this is an area which is still being looked at in different countries. And so there's not a full scientific consensus. But as Ivan mentioned, in Hong Kong, if you get your vaccine started with one vaccine, we are recommending that you get your second vaccine using the same type of vaccine. Now, I do want to point out that in the future, there are two quite probable scenarios that could play out. One of them is that if we get more information, it is quite possible that we will see more countries recommending a third dose of vaccine. That would be a a booster dose. There is another related possibility, which is also quite possible. COVID has now been around for, about 2 years. And it's quite possible that this virus is going to become an endemic virus, something which is just around all the time. And it may become a seasonal virus in the same way that we see influenza viruses or RSV viruses are seasonal. If that occurs and the virus stays here indefinitely, then it is quite possible that COVID will be a disease for which we recommend vaccines on a periodic basis in the future. So that's possible. We just don't know that right now. Now, there is another question which came related to mRNA vaccines and, is there any advice to improve how to make them more effective in preventing infections, particularly from variants of concerns and other mutants? So again, if we look at the data related to this question, most of the data suggests that 2 doses of getting vaccine, the mRNA vaccines, are going to be quite protective against severe clinical outcomes. And so this is really quite good news. But I think, again, it's also clear that if COVID ends up staying around indefinitely, then it's very likely that all COVID vaccines, regardless of the platform, whether it's mRNA or whether it's inactivated vaccine, are going to need to get updated. And the reason for that is that, the viruses that are out there in the real world, the COVID-causing viruses, these viruses are changing. And so they will begin to move away from the viruses that are covered in the current vaccines. And so vaccines, in essence, have to match what's going on in the real world. Now, there are companies right now that are working on booster vaccines. There are other researchers who are working on trying to develop vaccines which cover a lot of different versions of the COVID virus, moving more towards a universal vaccine. So whether those vaccines will become available, these more universal type vaccines, is not clear, and when that might happen. Again, the bottom line is don't wait for future vaccines. I think that if you have the chance to get vaccinated now, I think our recommendation would be strongly use the current vaccines now, and then in the future there may be different vaccines, and then you can get vaccinated with those, but don't wait around now for future vaccines. Now, another question which came is that are vaccines useful for the Delta variant? This is the variant that we've all heard about so much, and the one that is again causing rates of infection to go up in many different countries. So in general, I would say that the vaccines that we have right now appear to confer some significant protection against the Delta virus. And so probably less protection than against the original viruses, as Ivan mentioned, the early vaccines were based on the earlier viruses. And so the current vaccines probably confer less protection than they do against the original viruses, and yet they do provide significant protection, especially against severe outcomes. And so, again, the severe outcomes looking at things like serious illness, death, and so on. So again, the Delta virus is no reason not to get vaccinated. In fact, it's another reason to get vaccinated. It's clear that vaccinated populations in general do better against this variant than unvaccinated populations. Now, there is a number of other questions which have come up, these related to vaccination. And, basically, Ivan, Professor Hung has already discussed one of the questions, and one of the questions which came in is about the study related to mixed vaccination in Hong Kong up to now. And so Ivan had mentioned that there is a study going on out of the Apple Chow Vaccine Center, and so we'll have to see what the results of those are. Now, a second question that came in was if a person doesn't want to get vaccinated, is it mandatory? Do they have to do it? And so there is no blanket requirement for Hong Kong residents to get vaccinated. This is very much up for individual choice. Now, there are some smaller entities, and by that I mean, restaurants, maybe companies, and I'm sure airlines are thinking about whether they will require either people using their services or people working there to get vaccinated. So that's at the smaller entity level. But certainly for Hong Kong residents, as residents in Hong Kong, there is no blanket requirement. But here again, I want to try to put this question in perspective. And here I'll just talk about myself personally. Because of school reasons, when I was a schoolboy, and part of my work that I did in different places, and in part because I like to travel, I've received a lot of different vaccines. I've gotten vaccinated against hepatitis, tetanus, typhoid, yellow fever, polio, influenza, and so on. I know that when the borders open that I will want to travel. And I also know that there are going to be travelers who are going to want to come to Hong Kong. And both of those things, traveling myself personally or having people come in, is going to increase the risk that I'm going to run into people who are infected with COVID. And so again, when I think about vaccination, I think about it very practically, and it's what I urge everybody to do. I see it as a very practical measure for providing basically 24/7 protection for individuals. We don't have anything else like it. Masks, social distancing don't protect 24/7. And so rather than think about it symbolically, I would just urge you to think about it as a very practical step you can take. And as particularly if you're thinking about traveling or wanting to meet from people outside of Hong Kong. Now, a third question which came up is related to vaccination, but a little bit to the side, but is asking whether it's the goal of 0 cases in Hong Kong is both achievable and realistic. And also, are the current travel restrictions evidence-based? So here I would say that it's clear that it is possible to maintain, a 0 case to low case level. We are doing that in Hong Kong for some period of time. But it's only possible if you have very tight border and other control measures. And I think it's evident to everybody that the cost of this is very high. And by cost, I mean both finances and economic costs, but I also mean emotional costs and mental health costs. And so it's very costly to maintain that level of infection prevention and control. Another thing is that I think it's clear as countries around the world begin to open up their borders, Hong Kong will also open up its borders at some point. And I think it's clear that the COVID infection is not going to disappear from the world overnight. It's going to be circulating in many different countries. And so if the vaccination levels in Hong Kong are low, once the borders begin to open up, it does mean that the cases will begin to go up in Hong Kong. This is inevitable. So, in terms of whether these travel restrictions are evidence-based, I'm not really quite sure what the person means by evidence-based, but I think there are now many, many examples from around the world that show that travel restrictions can work and can help to reduce infections, but the costs, again, ranging from money up to emotional and mental health costs are very high. Now, there was another question related to what percentage of Hong Kong needs to be fully vaccinated before restrictions including travel bans, and the quarantine can be relaxed or lifted. So here, I think there are two basic points to understand. Oftentimes we hear about herd immunity, and we often hear that for this infection, a vaccination level of say 70 to 80% is required, or perhaps even higher, to develop herd immunity. But I want to point out that this is not black and white, and there really are no very precise estimates. I think the more realistic way to think about it is that for a place like Hong Kong, the higher levels of vaccination are, it's simply better. So 50% of the population is vaccinated. That's better than 20% of the population being vaccinated. But the second thing I want to convey is that lifting travel restrictions is not simply a matter of vaccination. It is a rather complex governance and risk management issue. And so it partly involves vaccination levels, but it also requires taking into a number of other factors. What is the level of public level of fear, or what's the public level of desire for safety? What's the desire for trade and tourism to go back to normal, and so on. So it's not a simple issue, but it is a very active issue right now, or question. Now, another question has to do with vaccine hesitancy. There are a couple of different questions related to this. And here I simply want to point out that vaccine hesitancy is so effective and so powerful because it's an issue which plays on people's fears and emotions. And so the real question is not what's the basis of hesitancy, but what can we do about it? And here I just want to point out two things that can be done. For those of us who are health providers or people who others come to for health advice, so we might be doctors, we might be nurses, we might be pharmacists, and so on, it's really important for us to equip ourselves with the facts. And when we talk with people and we give advice, to make sure that we're really talking based on the best available evidence. And because this is a new infection and because the science is very active, the best evidence keeps changing over time. So it's important for the health providers among us to keep ourselves updated. But for people who are not health providers and who are asking and looking for information, my suggestion is that there are some sources of information which I think are very solid. I think if you go to the website for the World Health Organization, or if you go to the website of the Centers for Disease Control, or you go to the government website, you will get solid information. And it's important to look at all of them. And then to see what those kinds of organizations are saying, and then compare it to what you're hearing on blog sites. I've seen some of the blog sites. I've had some of my colleagues show me what's being reported on them. And a lot of that information is simply either not true or it's not credible. And the easiest way for you to figure that out is to look at a number of different information sites, but really compare it with the ones who have been providing this kind of information for decades. Now, the last question that I have on my list here is that why are some countries still having severe challenges with COVID-19, even if a lot of people have been vaccinated, mostly vaccinated? And so Israel was given as an example. Well, one, when you look at the countries which have had high vaccination rates, it's very clear that when you look at how they are doing now compared to how they were doing earlier, the high vaccination rates have made a big difference. And so that's probably the single best comparison that you can do. But I will also point out that the vaccines that we have, they're not perfect. Some of them are excellent and are really good, but they're not perfect. The second thing that I'll point out is that in all of the countries, no matter how highly vaccinated, the percentage of people vaccinated is still below 100%. So there is no country with 100% vaccination rate. And the third thing is that I'll point out is that as we go further into this outbreak, that the viruses themselves are changing over time. And as they change over time, they will inevitably begin to escape some of the immunity developed to the earlier versions of the viruses. So just to repeat the basic point, it's very clear that the highly vaccinated populations are doing better. They have fewer deaths and fewer cases than they did them before. But, the vaccination rates are not perfect. The vaccines are not perfect. And so it's not really a surprise that we continue to see levels of disease in those countries. And then when we have a particular variant like the Delta variant, which appears to be more transmissible than the earlier versions of the virus, again, not so surprising that we see outbreaks of activity going on in these same countries. So let me stop there.
Thank you, Professor Fukuda and Professor Hong. We have received a few questions related to the COVID-19 vaccination. And so I will read the questions to you and see which of you would like to answer the question, or both of you can give us some points about that. The first one is, if I am easily allergic to food, like seafood or mangoes, and I also have slightly immune disease, should I take the vaccination? And which type of vaccination should I take? Thank you.
Yeah, KG, perhaps I can answer that question. With regards to food allergy, I've already mentioned that you can take the vaccine, either the Sinovac or the BioNTech vaccine are safe. And in types of autoimmune disease, it depends. In fact, even for patients with lupus, patient with rheumatoid arthritis, we strongly recommend them to get vaccinated once they've been treated. Or if you're saying that you have mild autoimmune disease, then presumably you may not be on treatment, and currently you have very mild or very few symptoms from that, then again, you can safely receive the vaccine. And both vaccines are safe for you. But if you want a more immunogenic vaccine, then probably BioNTech will be better than the Sinovac, but either the Sinovac or the BioNTech will be safe to get vaccinated.
Thank you. And then the second question, if somebody gets the shortness of breath and chest tightness for 2 or 3 days after taking the vaccine, but it stops after that, should that warrant a health checkup?
If the symptoms subside on its own, then again, you do not need any extra consultation. But if the chest pain persists, then I would recommend you to seek help. Then probably likely to be a very mild myocarditis, which is one of the possibilities. Or there may be other underlying disease that you have not been diagnosed that will require some medical consultation. Just to cover, as I realized that I was muted. So for the autoimmune disease, if you have autoimmune disease or if you have a mild food allergy, again, you could safely receive the vaccine without any problem. Either the Sinovac or the BioNTech will be safe for you. And we have patients who have history of lupus or rheumatoid arthritis and have received the vaccine without any problem.
And also one more question. Can we exclude any side effects that were developed on a later stage, say 6 months or more after the vaccination?
Well, currently we have not received any so-called delayed side effects as such. Now, since the program have kicked off in late Feb, so far we have not received any so-called delayed or side effects reported to the panel. And again, for other countries, we do not see any reports concerning a long-term side effects concerning the vaccine. So what I could say is that up to 6 months, I don't think there are any long-term side effects being reported. But again, this is a new vaccine. We are closely monitoring the situation. But based on the scientific evidence, I think this will be unlikely.
I can just add something to what Professor Hong said. These kinds of questions, again, take place in a context. And I think that it's important for everyone to realize, we've now passed the point of 188 million infections in the world. And we've passed the point of 4 million deaths in the world from COVID. And these numbers are going to continue increasing. And so the whole advice to get vaccinated is not taking place in a vacuum, but it's really taking place in the context of that we have the very real threat of ongoing infections for many years and so on. And it's really to protect against that situation. So there are theoretical fears, but it's taking place in the context of a very, very dangerous global situation from this virus. Thank you.
Thank you. And there's one last question. Is that whether the Delta variant can be neutralized by BioNTech vaccine because of the antibody-dependent enhancement mechanism?
Well, I think, first of all, we don't see any so-called antibody enhancement mechanism or any phenomenon in patients who have received the COVID-19 vaccine in those subjects. With regards to the neutralizing antibody or the efficacy, if you look at the latest Israeli studies, they are quoting a efficacy of around 64% for BioNTech against the Delta variants. And if you look at the Scottish data, it's better at 75%, and even better with the English data of 88%. So we believe that the mRNA vaccine has a good enough protection against the Delta variants. But of course, the exact protection rate or how good it is, and if you look at the breakdown of just infection or severe disease or mortality, we need more study on this. But definitely what I can tell you that it has a very good protection against the infection by itself. And more important is perhaps against severe disease and mortality.
Thank you, Professor Fukuda and Professor Hong, for answering so many questions. And we'd like to thank all of you for participating in this webinar.